Hello, everybody, and welcome. My name is Eunice Mathis. I'm a registered nurse and the owner of Florida Training Academy, where we train some of Florida's best certified nursing assistants, or for short, a CNA. And a CNA is vital. They are the ones who spend the most time with the patients. They report to the nurse. They do the baths. They provide vital signs. They communicate well with the patients, and they help them with their ADLs, which are activities of daily living, such as feeding, getting dressed, moving about the facility, going from one room maybe to like the activity room. They are just a great benefit to healthcare and to patient care. I'm here today to tell you about Senate Bill 558, which has pretty much passed in the state of Florida and might go into effect on June the 1st. And this bill is a little bit concerning to me because I don't think that CNAs understand the liability, the risk, the medical errors that actually could happen whenever they become what they call qualified medication assistants, or CNAs who can give medication. There is a nursing shortage, quote unquote. I don't believe there's a nursing shortage. There is a shortage of CNAs and nurses who refuse to do double the amount of work for less pay. And since these companies are able to get away with putting 20 patients on one nurse, 40 patients on one CNA, we know that care isn't being provided, but they're able to save money. And what they'll say is, well, we don't have any nurses, we don't have any CNAs. Where the truth is, you're not hiring the nurses and the CNAs, or you're not willing to pay them what should be required for them to do double the amount of work, especially post-pandemic when the patients are sicker and they need more care. But I'm going to digress. I just want to, put that bug in my CNAs. I don't care where you are. If you are able to become a qualified medication assistant, that means that you're also going to be able to be sued for malpractice. I am not an attorney. I am a nurse and I am an educator. And I'm really concerned about my CNAs, especially the new CNAs who are going to be partnered with one nurse who is also new, passing medications to dozens of patients. All right, so let's get into this bill. All right, so Senate Bill 558. The introducer is the Healthcare Policy Committee and Senator Burton. And if I didn't say it before, I'm in the state of Florida. And the subject is certified nursing assistants. Let's go down to the summary. Senate Bill 558 creates a new designation of qualified medication aide, QMA, for certified nursing assistants who work in a nursing home and meet specified licensure and training requirements. The bill allows a nursing home to authorize a registered nurse working in the nursing home to delegate medication administration to a QMA who is working under direct supervision one of the RN. I just told you that in some of these facilities, they only have one RN. And so that one RN who also has a full patient load also has to supervise the other CNA, hopefully there's one there, and the QMA. Let me continue reading. In order to be designated as a QMA, a CNA must hold a clear and active certification as CNA for at least 1 year preceding the delegation. Complete 40 hours of training that consists of 6-hour training course currently required for a CNA to administer medication in a home health setting, and a 34-hour course developed by the Board of Nursing specific to QMAs, and successfully complete a supervised clinical practice in medication administration conducted in the nursing home. The bill amends several sections of the law related to the delegation of tasks to CNA to conform to the changes made in the bill. The bill also specifies that certified nursing assistants performing the duties of a QMA may not be counted towards staffing requirements for nursing homes. Number one, direct supervision is defined according to the Rule 64B9, and you can see the rest of the numbers there, to mean the physical presence within the patient care unit of a facility, of a healthcare facility, or physical presence within a healthcare agency of a program instructor who assumes responsibility for the practice of the certified nursing assistant. So nurses, that means that all those tasks you have, you are now directly responsible for your QMA. And I have heard stories from other nurses who are working in facilities right now where the CNAs won't listen to them. So if the CNAs won't listen to you, here it is, the QMA who you are responsible for may not listen to you either. And so I really want my CNAs, my students, to take all of this into consideration, because your goal, unless you want to be a career CNA, and there's absolutely nothing wrong with that, but most of our students use CNA as a stepping stone to become a nurse in order to get their clinical hours for the PA or the pre-med programs. So I don't want you all becoming QMAs. Because if you make a medication error as a CNA, that could be detrimental to your future licenses within healthcare. All right. So we don't want you, unless you just really need that extra $1 an hour for this extra responsibility, I would ask that you just remain a CNA, continue doing great bedside care, and then you can pass medications once you become a nurse or a doctor or a pharmacist. All right. So let's continue to read down. Present situation, nursing homes. Nursing homes in Florida are licensed under Part 2 of Chapter 400 Florida statutes and provide 24-hour-a-day nursing care, case management, health monitoring, personal care, nutritional meals, and special diets, physical, occupational, and speech therapy, social activities, and respite care for those who are ill or physically infirm. Nursing homes are regulated by the Agency for Healthcare Administration. We call it AHCA. Currently, there are 708 nursing homes licensed in Florida. Certified nursing assistants are regulated. Their regulations or their rules are found in Part 2 of Chapter 464 Florida statutes, and then it gives you the section there. It defines the practice of a CNA as providing care and assisting persons with tasks related to the activities of daily living. Activities of daily living include tasks associated with personal care, maintaining mobility, nutrition and hydration, toileting and elimination, assistive devices, safety and cleanliness, data gathering, reporting abnormal signs and symptoms, post-mortem care, patient socialization, reality orientation, end-of-life care, cardiopulmonary resuscitation, and emergency care, patients' rights, documentation of nursing assistant services, and other tasks that a CNA may perform after training. Now add to that, you can give medications in a nursing home. And they're going to pay you a whopping $16, $17 an hour. Keep that in mind. A CNA can work in a nursing home, an assisted living facility, other community settings, a hospital, or a private home under direct supervision. The Board of Nursing within the Department of Health certifies CNAs who must, among other qualifications, hold a high school diploma or equivalent, complete a 120-hour Board of Nursing approved training program, and pass a nursing assistant competency exam, which includes written and practical portions. So this bill is a little off because in the state of Florida, CNAs can challenge the exam. And so what we do here at Florida Trade Academy is we offer 2-day CNA courses, and we have for the last 15 years. And so before you ask, well, what do they learn in 2 days, or how can they learn all that in 2 days? They can, and they do. We usually have students who are pre-med, pre-nursing, or previous home health aides. And so they are usually the smarter students, and they just need to learn their hands-on skills, which is why we have so many videos just to help reinforce learning. But now you take somebody who attended a 2-day class, and most of our students are not going to be career CNAs, by the way. They're using this for upward mobility. But let's just say it was another facility here in Jacksonville that was not nurse-owned, that doesn't know the full dynamics of patient CNA nurse dynamics. And now here it is, they rushed through training. They weren't taught to think critically the way that I teach my students. And now here it is, oh, take a 4-hour class and you can pass medications. You'll be fine. You will not be fine. Our patients will not be fine. If you are thinking about becoming a qualified medication assistant, I need for you to really own this job, own this title, and make sure that you understand those medications that you're giving to those patients. And it may take you a while, but I need you to know, as far as like your cardiac medications, your diabetic medications, what's going to happen if the person receives too much, too little, or receives the medication late. It's a lot to consider if you want to take a quick route to pretty much becoming a mini nurse, but not getting paid for all of the job duties that they want you to provide. All right, so a CNA must biannually or every 2 years complete 24 hours of in-service training to maintain certification. And I'm just going to go down a little bit further. All right, so let's go ahead and read the rest of this bill. The BON, which stands for Board of Nursing, establishes the general scope of practice for CNAs. A CNA performs services under the general supervision of a registered nurse or licensed practical nurse. A CNA may perform the following: personal care services, tasks associated with maintaining mobility, nutrition and hydration tasks associated with elimination, such as toileting, tasks associated with using assistive devices, maintain the environment and resident safety, taking measurements and gathering information or gathering data, such as the blood pressure, recognition and reporting of abnormal resident findings, signs, and symptoms, post-mortem care, tasks associated with resident socialization, leisure activities, reality orientation, and validation techniques, tasks associated with end-of-life care, perform basic first aid, CPR, and emergency care, tasks associated with compliance with residents' rights, and documentation of CNA services provided to the resident. A CNA may not work independently and may not perform any task that requires specialized nursing knowledge, judgment, or skills. However, I digress. They're going to let you pass meds because there's a nursing shortage. Current law allows the RN to delegate medication administration duties to a CNA, but only in a home health care setting or in a local county detention facility. Specifically, a CNA may administer oral, transdermal, which is a patch, ophthalmic, the eye, otic, ear, rectal, yes, inhaled breathing treatments, or either like the asthma pumps, enteral through a gastric or a feeding tube, or topical on top of the skin prescriptions. If the CNA has completed a 6-hour initial training course approved by the BON, Board of Nursing, and has been found competent to administer medication to a patient in a safe and sanitary manner. So what they can't do is they can't do injections and nothing intravenous. But a lot of your patients, especially your diabetics, they're on anti-diabetic agents. They're oral, they're pills. And so I have heard of a CNA, when we say we can give a medication an hour before, an hour after, there was a QMA, a CNA who's able to give medications, who just switched the whole rule. And she said, oh no, I have 2 hours to give medication. You do not have 2 hours to give medication. If you have 20 patients, you need to give all of those patients. You can't be like, oh, you're supposed to have your medicine at 8 o'clock, but now it's 10 o'clock. I can still give you that medication. You cannot. You either get those medications an hour before or an hour after. So if they're due at 8 a.m., come in early, get those vital signs done for all 20 patients, and then start giving out those medications, starting at, as soon as you can, as close to 7 as possible, because by 9 a.m., all of your 8 a.m. meds should have been administered, not 10 a.m. But that's why they have you all taking this course. In a whole 4 to 6 hours, you're going to learn all this. And even though you're not supposed to use any specialized nursing knowledge, judgment, or skills, they're going to let you give medications. All right, so both the training and competency determination must be conducted by RN. Additionally, a CNA must satisfactorily complete 2 hours of annual in-service training to maintain his or her authorization to administer medications. The Board of Nursing requires the 6-hour course to include a glossary of common terminology for labeling of legend medications. A legend medication is just something that's common, such as Tylenol. Safe administration of oral, transdermal, ophthalmic, otic, rectal, inhaled, enteral, and topical prescription and over-the-counter medications, record keeping and documentation of medication administration, safe storage and proper disposal of medications, and then the prevention of medication errors. Under general supervision, the registered nurse or licensed practical nurse does not need to be present, but must be available for consultation and advice, either in person or by a communication device. And that's based upon the Florida Administration Code R64B9, and you can read the rest of the numbers there. So, how do you feel about this? I know as a CNA, you're like, oh, it's a great opportunity for me. As a nurse, I am so concerned for my CNAs. If there is an attorney out there who would love to go live with me so we can talk about this, so we can help prevent medical errors and malpractice. Anyone who is administering medication, that's from the start, from the physician writing the order to the pharmacy dispensing the order to the nurse who's supposed to approve the order to the CNA who's actually giving the medication. All of those parties could be involved in a medical malpractice case if the medication is given and it's given wrong, or there's an untoward effect that happens with the patient. So I need you all to help me make this make sense. I know there's a nursing shortage. There has to be a better way. All right, so leave your comments below. Again, this is Eunice Mathis with Florida Training Academy. Just want to let you know that pretty much this bill has been passed, and that July 1st in the state of Florida, CNAs can become QMAs. And I'm not sure if I'm going to actually teach the course. People call me all the time. They're like, hey, Eunice, are you going to teach the med tech course? My answer is usually no, because I end up failing the students. And it's so unfair because there is another nurse somewhere else who's just passing everybody. I will not pass you if you don't know how to complete a MAR. I will not pass you if you come in here tired. And this is a full 6-hour course. I need you to administer medications. I actually have to see you give intro medications. I have to teach you about aspiration precautions. I have to teach you about crushing medications. Hopefully, if you have a patient who has a PEG tube or a feeding tube, hopefully the medications will come from pharmacy already in a state where maybe like a liquid state, so that you don't have to crush pills. But there is so much that goes into medication management and administration, and then following up and just preventing med error. So you all, I digress. Have a good day, everybody. It's Eunice with Florida Training Academy. Bye-bye.